tear, it falls and hits the ground. A tree, it falls without a sound. A bird, it calls and sends you home. A man, he sits in the cold all alone.
Hi, Tara. Welcome to the Joy of Sunflowers. Thank you so much for joining me. Please introduce yourself a little bit more.
Hi, so my name is Tara. I am 32 years old. I grew up in Washington State, and our fertility journey has led us to Texas. So my husband and I have been married for 7 years now, and we have two little dogs, and yeah, that about sums it up.
Yeah, cool. I know a few people have moved for fertility treatments and because of fertility. So yeah, it's never fun moving, but it's probably even more stressful when you have that kind of a reason as well. Um
Yeah, that was the hardest thing
yeah,
we've
so
ever had to do.
let's start from the very beginning and then dive in. So did you always know you wanted to have kids, or was it something that you sort of came to?
I've always wanted to be a mom since I was really, really little. I've always wanted to have kids. I pictured myself having like 5 or 6 kids. So it's always just been kind of an ingrained desire that, yeah, I've just always wanted to be a mom. And I've worked with kids for a long time. I'm a dental hygienist and I was a dental assistant before then. And I've just always really enjoyed working with kids in my dental practice. And yeah, so it's just always been a desire of mine.
Yeah, they are cute little things. Um,
Yes.
so how did you sort of get into the journey of trying and realizing that, it wasn't going to come easy?
So my husband and I started trying um like immediately after we got married because I had issues with just kind of general like period issues and pain. Um, and when I had an IUD placed, um, they found out that I had a bicornuate uterus. So I thought I was just always going to have problems getting and staying pregnant. That was always just kind of a fear of mine. So we started trying right away, and we actually got pregnant right away, like a month after we started trying, and unfortunately miscarried at 7 weeks. But it just we got pregnant right away, and then I started worrying even more that it wasn't going to be a reality. And I wanted to seek fertility treatments right away after a first miscarriage. And I was told that you have to have three in order to qualify to see a fertility doctor. So that's kind of when that was like the first kind of rocking of the boat when I knew that it was going to be a fun path to walk down.
Yeah,
So yeah, that's
that thing that they say, you're like, really? Three,
yeah,
three,
yeah,
to go through three of these. Are you serious before you're going to do anything?
yeah,
Oh, it's just
yeah, that
weird.
was and I've never been one to be told I don't like the word no. So I just walked into the fertility clinic myself and said that I wanted to be seen. Um, but yeah, that was kind of my first, I guess, realization with how broken our healthcare system is. Because that's just it's not okay. That's not okay.
No, good on you walking in anyway. Like, hey, treating me right now.
Yeah, somebody else gets to tell me no, and if you tell me no, I'm going to find somebody else.
Yeah. Yeah, I've
So
heard,
yeah,
if you keep looking, you're likely going to find someone who is willing to do it, who's willing to.
yep, yep. which is good. There's good doctors out there, but there's a mix of not so great ones either.
Yeah. So I'm guessing self-advocation has been like a big thing for you on for your journey.
Yeah, yes, it definitely has.
Yeah. So after that, so after the first loss, you went and try and made an effort to get some fertility treatment. So how did that go? Like you walked in, so did they help you or did they tell you no?
Yes.
Oh,
Yeah, they did. They took, I mean, they scheduled me for a consult, and they did kind of the full fertility workup. Um, we did an HSG, we did an MRI of my bicoordinate uterus. Um, we didn't have the ability to do any pathology testing with the baby because that wasn't given. I didn't know about that, and it wasn't an option um, when we had our DNC, which is still kind of frustrating to me. Um, but yeah, they did kind of the full workup and said that everything was fine and to keep trying naturally for 6 months. So that was the first appointment with a reproductive endocrinologist.
that's so frustrating when they say that. You're like, well, if
Yeah.
I'm fine, then why did that happen?
Mm-hmm. Yeah.
It, it, oh, I had someone tell me, your uterus looks amazing. And I'm like, well, I just had a miscarriage, so that's
It's not feeling quite amazing. Yeah,
oh,
exactly.
it's so great when they say stuff like that. I'm like, you're
Yeah.
the most fertile right now. You should try for more babies. And you're just like, I just
Yeah.
want one. Thanks.
Yeah. Thank you.
Ooh, and yeah, what you said about like not knowing about the baby and like they can test the baby. I didn't realize that they could test when you have one at home. So apparently you can take
Yep.
the whatever it is. For me, it was a sack. But you can
Yep.
take that like I think
In.
frozen, but you can take it in. And I
Yep.
didn't know. Like I would have done that if someone had told
Yeah.
me that I could do it. I didn't find out until I had my radiology like appointment like a week or so later to make sure everything was all good. Um,
Yeah.
but he was like, "Oh, did you get it tested?" And I was like, "No, I had it at home." And he was like, "Oh, you can still get it tested." And I'm like, "Well, I can't now."
Yeah. Yeah. I'm actually I run a small business that supports women and infertility, and I'm in the process of putting together miscarriage kits for like at home so that you have everything that you need at home if you do want to get it tested and to kind of know your options. And I'm hoping to be able to like bring those into fertility clinics and OBGYNs and stuff to be able like if you don't know, you don't know. And if you don't have access to those kinds of things, I just it you kind of I've regretted not bringing our baby in and having them tested.
Yeah. Yeah, that's so beautiful that you're doing that. I think it's such an important thing, like having a kit or having something. Um,
Right. That's like step by step. This is what you do. And it has the little
yeah.
collector thing so that you can keep the little baby safe and put it in the freezer and bring it in. And I'm hoping it will help women.
Oh, yes. It would
Yeah.
help me. Because yeah,
Yeah.
when I was going through my miscarriage, I was, in the doctors and she was well, no, I don't think I was in the doctors. No, I had a phone consult. That was what it was. And over the phone, she was just like, what do you want to do? Natural, whatever, and I said natural. And she was like, okay, well, just do it at home then. And I was like, okay.
Good luck.
Yeah, it was like
Yeah.
no
It's mind
information.
blowing.
Yeah.
No.
I was like,
Yeah. And
okay.
you're giving birth at home. And that's why I don't the like lack of um like severity, I think is the right word,
Mm,
that like it's not going to be comfortable. It's not like a heavy period. It's you are giving birth at home.
yeah. I will say I have had one speaker who actually said it was like a heavy period. I didn't believe her when she first said it because I was like, I haven't heard that at all ever.
Yeah. Well,
So
that was not my experience with
but it
all 5 of mine.
yeah, yeah. Oh gosh.
Yeah.
Okay, let's go through that. I purposefully don't look at anyone's stories before I come on here, so I like don't know your story because
Okay.
I want to be normal and natural.
Yeah.
I'm gonna cry. I'm gonna cry. You know, I want to just be like a human. You know, I feel
Yeah.
like if I look at too much, then I'm not gonna be like my normal reaction self. You know,
Yeah.
I'm not gonna be emotional. You know, so
Uh-huh.
just allow it. You know.
Yes.
So yeah, so okay, let's go into that then. So you had your loss, you went for testing, they told you were all good and you should keep trying for 6 months.
Yeah.
So I don't want to know, but I do want to know what happened after that? Like,
So after that appointment, I kind of kept digging around for just kind of a regular OB that would help me. And I found Dr. Chin at Olympia OB, and she um, did a few medicated cycles with us, and she did some extensive testing. Um, she found elevated prolactin levels, which were not found with my RE. Um, so we after that first appointment with the fertility doctor, um, we kind of made our own way and continued trying naturally. I think for a couple months, and then we found Dr. Chin, and she did a couple medicated cycles and some more blood work that they neglected to do at my first fertility appointment. And she found elevated prolactin levels. Um, and then we went down that rabbit hole of treatment because they sent me back to the fertility doctor, and I said I wanted to see a different doctor at that clinic. And the elevated prolactin, he just put me on bromocriptine, which is to lower your prolactin levels. And I didn't do well with that medication. And then he tried a different medication, and I didn't react well with that medication either. So then he sent me up to UW endocrinology to get an MRI of my brain. And they found a tumor growing on my pituitary gland. So that's the little hormone control center in your brain that tells your body what hormones you need. And so they found a 7 millimeter prolactinoma, is what they termed it. And the only treatment for that was the bromocriptine or cabergoline. And I just had really bad side effects with those medications. But I continued taking the bromocriptine. And then we got pregnant naturally again after starting that medication. And I believe that one, our first pregnancy, I think I may have misspoke. We miscarried at 11 weeks naturally. And then our second, after starting the bromocriptine medication, I believe it was like a 9 weeks that we miscarried again. And then so that was number 2. So then we started seeing the fertility doctor again because that was number 2. So yeah. And I think somewhere in there we switched over to a different doctor. We changed clinics completely because I just didn't like what they were telling me and how they were treating me. Like I think if you want to do IVF or you want to do IUI, that should be an option. I we pay out of pocket for it anyways. So I don't understand why like you can't do it when you want to do it. That's a big, I don't understand that.
Yeah, you're paying for a service, you expect the service you want, not the service
Yeah,
decide for you.
right. And so we switched over to kind of, it was a one doctor clinic in Seattle. Um, it was Sound Fertility Care, I believe. I've been to so many doctors, I should know this, but um, so yeah, then we started seeing Dr. Lynn, Dr. Kat Lynn. I can't remember the name of her practice, but she was absolutely amazing. But way more expensive too. And she was willing to do a couple IUIs for us. We did 4 rounds of IUI, and those didn't work. And then we talked about jumping into IVF. But between the last IUI and when we started talking about doing IVF, I was having severe right-sided pain. I went to the emergency room a couple times thinking it was my appendix, and it wasn't. And then I went to her thinking that maybe it was like a cyst or something. I have a cyst on my right side that's just kind of always been there. And I thought maybe that it was getting bigger or growing. But then she referred me to Dr. Marissa Dahlman to do a laparoscopy because she thought it was endometriosis. So then I got referred to do a laparoscopy where they found stage 4 endometriosis, um, which was kind of a relief because it explained a lot of my pain and like why things were happening. It was kind of one more box to check, but it gave us quite a few answers too. It was all over my appendix. So that's why they thought I was having like the symptoms of appendicitis. So they took my appendix. Uh, it was it was all over my liver, um, and my bowels and my pelvic floor. So it was quite an extensive surgery.
Wow.
But then, yeah, after that, healing from that, we went into IVF. So yeah,
Gosh, that is full on already, and we haven't even gone into the IVF yet. And I know that is
right.
like I've
Yeah,
heard so many stories, and your story already, like that is so much to deal with. Like, I mean, I
yeah,
can feel strong during that time because a lot of women don't, but wow,
right.
you're amazing. Like that,
Well, it's a lot to carry. And
yeah,
it's kind of like you only like you can only focus on one thing at a time. Otherwise, it's like mind blowing. Like you're like, how did I even get here?
yeah. Yeah, I mean, some of the women I've talked to, I'm like, how are you alive? Like, you're amazing. Like,
Yeah.
what is going
When
on?
I think about that, it's like I don't know how I made it through it. I feel like with trauma and grief and you just kind of like get numb to it and you like black out.
Yeah,
Like you just
your defense mechanism, right? Like your
yeah,
brain is protecting you and helping you like stay alive and keep you
right.
moving and stuff, you know. Um,
Yeah.
what have you found that you have done like through this journey that has kind of helped you like be okay? I mean, I know you said there's blinders on, like you've got this sort of almost tunnel vision. So
Yes.
how's that kind of played out throughout this time that you've been going through everything?
Well, a lot of therapy. I have an amazing therapist that has been with us. She did our premarital counseling too, so she's been with us like our whole journey. Um, and she's gone through infertility too. So I feel like a lot of uh therapists don't really understand like what, and so with people that are going through infertility, I feel like a therapist that actually has been through it is super important because it's expensive. Therapy is very expensive if it's not covered by your insurance. And I didn't want to spend a whole bunch of time like explaining the procedures. So like I tried other therapists that weren't as expensive, and I found myself like having to be like, okay, well, we just did a transfer cycle. And it's like they don't really know what that means. So I spent most of my time that I was paying for their services explaining to them what the procedure was. So that I think is a big thing. Our first clinic that we went to actually has a therapist that they provide for you, that has gone through it, and I really liked her. Um, but I think that's a really important part of going through this, and support groups too. I mean, I have my little fertility rally support group that I wouldn't trade for anything. It was the best thing I ever did. Just finding other people that have gone through it, I think is very validating and reassuring. And like I wouldn't wish this journey on anyone, but having other people that get it is super important.
Yeah, no, it's so true. Like just doing this event, talking to all of these amazing women, including yourself, you know, it's been really just kind of, yeah, validating and healing because we're able to talk and we come from a place of understanding. We're not just like, you know, talking to a wall or someone we have to explain every single little thing to.
Right.
The person kind of gets it, you know? So
Yeah.
it's been really, I can understand that. I haven't ventured into groups myself yet. I think there's just that like that fear holding me back. I don't know what the fear is about, but for some reason I just don't want to go there yet.
Yeah.
But yeah, I think it's different for everyone, but I have heard amazing things about groups and how like it's like, you know, family, like in a room together.
Right.
You're all, you know, connected through this horrible thing that you've gone through, but it's kind of beautiful in that you're all there and you're there for each other. So
Right. Yeah, and there are definitely like ups and downs with support groups too. Fertility Rally in general, I think really looks out for like the safety of the people that are in their support groups, because like I mean they're different phases that you go through in this journey. um and as what I like to coin myself, a long hauler, because I've been in this space for so long. It's been 7 years, and I like I started with like my first transfer buddy, right? Like you find other women that are transferring at the same time, and they all got pregnant and I didn't, and so like there's that aspect of it too. And like now my first transfer buddy is on second and third child, so like it's a little bit of a left behind feeling, but I feel like Fertility Rally really looks out for that and like separates the different groups so that you have like your core people that are in the same boat that you are in, so it's not triggering, because a lot of it can be.
yeah, yeah, especially like you said, like if you've got people in your same group as you who are, you know, getting the results that you're wanting
Right.
that haven't got yet.
Hmm. Yeah.
Fertility Rally, that's run by Ali, isn't it? From
Yes.
yeah, I'm going to be speaking to
Yeah.
soon, so that
Oh, yeah. She's great.
great to speak to her. Yeah. I love the name of her podcast. Like
Uh-huh.
for those who don't know,
Yeah,
it's
she's great.
Soul AF podcast. So very, very good stuff. My husband's like,
Yes.
is that a bit negative? And I'm like, it's sort of making a joke out of it in a sense. Like we, you know, if you don't laugh, you cry. It's
Yeah.
like we've
If you
accepted
don't
it.
laugh, you cry.
Yeah, we have to make a joke-ish, you know, some of the things
Yeah.
like I had a few laughing moments with some speakers yesterday, and the day before, and I was like, should we really be laughing about this? And they're just like,
right? You have to. I mean, in my opinion, because I like to laugh and I like to have fun, and like my life is amazing other than this one thing that is running it. So, I mean, there's so many things to be happy for and laugh about.
and I mean, some of the things that happen are so bizarre, and you like,
Oh,
and the things that people say to you as well. You're just like,
yeah, don't even get me started with that one.
oh, why did you even think that through? Like,
Yeah,
did you
they
wake
don't
up
think
on
where
the
they
wrong
open
side
their
of
mouth.
something? Like, oh, yeah, no, it's good. It's good. So where did you go from there? So you went through all the endo and the um surgeries, and then you were like, IVF. I'm ready for IVF now.
Yes. So I was with Dr. Lynn, and she was a one doctor practice, and she had a heart to heart with me. I said, why? Because I was looking at going back to Seattle Reproductive, just like cost only. And I said, why? Because Dr. Lynn's one round of IVF was like double of what SRM was. And I said, so what can you give me that's double the cost? And she was super honest with me and told me that like the endometriosis may cause a factor in your retrievals, but I would put you on a standard protocol. So if you want to go back to SRM, because they have a program that's like buy two, get all your transfers free kind of a thing. Um, and I know that sounds horrible, but it is what it is. It's a double cycle program. You pay 36,000, I think it was, for 2 rounds of IVF. That doesn't include your medications. So you get 2 retrievals, and then you get unlimited transfers until you run out of embryos or you bring home a live baby.
Oh,
So for me, that seemed worth it because 1 round of retrieval at Dr. Lynn's office was around $36,000 to $40,000. Um, so yeah, we decided to go back to SRM um, and do that 2 cycle program. So my first, and then I found Dr. Dudley at Seattle Reproductive because one of my really close friends had used him and really liked him. So we decided to go with him. Our first retrieval, so our first stim cycle, uh, went just according to plan. I believe we had like 11 follicles um, retrieved and like 10 of them fertilized, but then they all dropped off and we only got one blastocyst. So that was kind of like a kick, a hard like reality check that like this might not work. Um, and we did do genetic testing. So we decided to send off that one for genetic testing. And we were kind of not very hopeful that it would be because just like the attrition rates and how the percentages go, it's not likely that the one that made it um, would be genetically normal. But our one came back and it was genetically normal. And then we decided to go right into a second retrieval. But we did a microdose Lupron protocol for the endometriosis, and we ended up getting 6 genetically normal embryos with our second round. So we had a total of 7 embryos that uh, were genetically normal, high rated, um, and frozen.
yeah. So 7 chances. I like it.
Yes, 7 chances. Um, And then trying to think of what happened after that. We did one transfer. We did our first frozen embryo transfer, and I talked to Dr. Dudley about doing an ERA cycle to see, because my progesterone has always been an issue. I've always had low progesterone, just kind of like even with working with my naturopath and stuff, we would do cycle day 3 and cycle day 21 day tests just to see where my hormone levels were at. And it was always super low. So I wanted to know, I wanted to give like the best chances, and I wanted to run all of the tests before we transferred. And he told me, I asked about immunology testing and I asked about an ERA cycle. And he said that those weren't a thing. So we just went forward with doing a transfer. And we did kind of a hormone, I think it's called a hormone replacement cycle, where you do estrogen, progesterone, and then you put the embryo in. And our first one worked. And so we were super excited. We knew we wanted to do IVF, or it was recommended to do IVF for us just to test, to know that they were genetically normal embryos and that that's why I was miscarrying. So it would take out the genetically abnormal component of our miscarriage. So we would know that I'm not miscarrying because it was a genetically abnormal embryo. So we felt pretty confident as to like that this was going to be our baby. We were going to take home this sweet little boy. And they didn't, so SRM doesn't test, like do midway labs or any type of hormone monitoring for me. They didn't anyways. So I had to ask them to do, they usually just do HCG. So they test on beta day for your HCG levels, and then 2 days later they test another level of HCG. So they don't test any progesterone, any estrogens. They don't monitor that, which is absurd to me. I don't understand. If you are giving someone progesterone and estrogen, I feel like it's neglectful not to monitor those levels. It doesn't make sense to me. But they ended up doing it, and my progesterone levels were low. So they were like 8 or 9, and usually you want them like 12 and above. And so he upped my progesterone, and then I started bleeding. So I went in, and it was during COVID. So nobody was allowed into, like my husband wasn't allowed to come in for the transfer. We had to FaceTime for the transfer. He wasn't allowed to come into any of the appointments at all. So for the transfer, he was waiting out in the car. And then we were having issues with my progesterone level rising. And then it was right before our 6-week ultrasound that I started bleeding. And I went in for an ultrasound, and I was passing like really big clots. And the first appointment, I was fine. Like Dr. Dudley did the ultrasound, and he said that the baby was fine. We could see the sac and the little fetal pole, so everything looked good. And then I continued to bleed and pass large clots. But he found a subchorionic hemorrhage on my first ultrasound. So he saw the baby, saw the fetal pole, but a subchorionic hemorrhage was visible too, which I've had with every single one of my pregnancies. but he attributed the bleeding to that. And so we waited and then came back in for another ultrasound a few days later with a nurse. And the day before the ultrasound, had passed what I knew was the baby. And yeah, so then we went into the appointment, and my husband wasn't allowed to be in the room. So I went in, and that's when they told me that we had lost the baby and they couldn't find the baby. And then I had to go home and tell my husband that because he wasn't allowed to be in there with me. So that was very isolating and one of the worst experiences of this whole journey. And we kind of wanted to stop after that experience. So we took some time off, and then I did some more testing on my own through Pregmune because I wanted to find out what was causing this. I wasn't going to go through with another transfer without figuring out why. And so we paid out of pocket for more immune testing, and they found that I had antiphospholipid syndrome. Well, the first marker that came back, because to be diagnosed with antiphospholipid syndrome, you have to have a first test come back positive and then wait 6 months and have another test come back positive. And I think you have to do that 3 times in order to have a diagnosis, a for sure diagnosis. And then some other things popped positive too. And it was recommended through this Pregmune report that I have intralipid infusions, prednisone, and a blood thinner. So I talked to Dr. Dudley about that, and he said that reproductive immunology is not a real thing. They're preying on women that are miscarrying and just trying to give some sort of answer that isn't researched or proven or studied. So yeah, that was his answer to that. And then that I lost all confidence in his ability to treat me as I needed to be treated. So I made an appointment with Braverman, BRI, and they're a reproductive immunologist. And he recommended exactly what what the Pregmune test did. And so they're in New York and I'm in Washington. And he said that he could prescribe everything except the intralipid infusions or the IVIG out of state. So if we got pregnant again, or if we wanted him to monitor another round of IVF, that I would have to find a doctor local to prescribe the intralipid infusions. So I went to every single doctor in Washington, it feels like, to try to find somebody that would prescribe the intralipid infusions. And I could not find a doctor that would prescribe the intralipid infusions. And there was one in Chicago, one in New York, and one in Texas. So we packed up all of our stuff into a trailer and drove to Texas. And that's where we are now. And so I'm with Dr. Putman at Dallas Fertility Center, and he does kind of all of he followed my Pregmune report. He prescribed what they are recommending for me. I see him at every single appointment. We've done 2 transfers down here that were unfortunately unsuccessful. Our first one was a chemical. So it was like a 5 HCG. So it was a chemical pregnancy. And then our second one just didn't even implant. So now we took, um, and he actually wanted to do the ERA test right away when we first came down here. But I feel like I was so traumatized from everything that had happened to me that I was just like, I just want to do a transfer. And then if we don't get implantation, we can talk about it, because I'd had implantation with my first frozen embryo transfer. So I didn't really see the benefits of doing the ERA. But yeah, so now we're here. We did 2 transfers with Dr. Putman, and right now I'm currently waiting to get my period to start our ERA cycle. So we're going to do an ERA, Emma Alice, and then use those findings to do our 4th frozen embryo transfer.
Wow.
So yeah, that's been the last the last 7 years in a nutshell.
Yeah.
I feel like I tried to sum it up because I could literally talk for hours.
Oh yeah. Like there's so many layers and like trauma layers and like,
oh yeah.
It's pretty full on. What made you decide Texas? I like, my husband and I want to move to Texas. We're in Australia. But really want to move to Texas. But yeah, what made you choose Texas? Because like you had a few
different. Yeah, we could not afford to live in New York. I didn't really like the idea of Chicago, and my husband and I love Texas. I mean, we have been coming to, it was so funny because like the first year after we got married, I wanted to go to Texas. And he randomly picked Weatherford, Texas, like just randomly threw a dart, and we loved it. Like I love it. We love it here. And we've been coming back every year since we've been married. And it just, the weather's great. We did have a tornado yesterday. But other than that, we just love it. The people here are great. Like it's kind of like you went back in time a little bit. People like open the door for you and like make eye contact. Everybody's not like walking around with their face in their phone. But yeah, so and we just love it here. So, but we had nobody. Like we are all, my family, my husband's family, all of our friends. I mean, we've lived in Washington. I've lived in Washington my whole life. Never lived anywhere else. And so and I'm super, super close with my family and his family. And we had a really strong core group of friends, and we just packed up and left, and we knew no one down here. No one. So it was very much a leap of faith, and yeah.
The things we do in pursuit of family. I had I spoke to her about her fertility journey, and she had to move from England to Canada to get treatment for fertility, like doing IVF and stuff, because she in the UK apparently they have some BMI like levy thing.
Oh, I've heard about that. I
was like, what are you talking about? And she's like, yeah, and I have PCOS, so weight
it's like
gain is a thing, you know.
I so broken.
I know. I was like, what? And she's like, yeah, they said my BMI has to be this, like it was like 31 or something, or 30 in order for them to treat me. And I was like, okay. And she's like, and I just haven't managed it. She said at one point I managed it, and then it went back up again, and then they stopped treatment.
Yeah, and who wants to step into IVF with the fear that it could get canceled at any time? Like it's already a hard thing to go through. Like let's add that layer to it.
Oh, yeah.
And I just don't I don't think that that's appropriate in any level. Like I get so many like questions, and like people message me all the time about, well, if you just lose weight, you'll get well, no, because most of the time, like if there's a stipulation on your BMI to start treatment, you're going to do whatever it takes to lose weight, and it might not be the healthiest way to lose weight either, which can impact all sorts of different systems in our bodies. It's just that it's not, I don't think it's appropriate.
And
But
there's all different conditions as well that can cause weight gain and can cause,
yes,
and I think
IVF, I've gained 20 pounds doing IVF.
yeah, no, like the hormonal treatments, like everything
Yeah.
that messes with your body. Like it can, make you gain the pounds, which really sucks. And I've heard some stories. Like,
Yeah.
people need to realize that weight gain isn't just about food and like eating too much.
No,
There are other
it's not.
factors that can cause weight gain, and like PCOS, like that's
Yeah, I have PCOS too.
oh my God.
Yeah, so it's like
Just add that
yeah.
one. Just
Yeah, might as well, right?
enjoy
Yeah.
PCOS. Yeah, no.
Yep.
Wow. I'm so sorry you have to deal with that.
It sucks, but a lot of good stuff has come from me struggling to start a family. And like I feel like I'm on this journey for a reason, and it is what it is, kind of. Like I started my small business from our journey. I have met some amazing people. I it I have learned so much about my body and how powerful it is to know what you're going through and to be able to advocate for yourself. I mean, I've grown, so my marriage has grown through this. I mean, this hasn't broken us, so I don't think there's anything that could. I mean, there's a lot of good, and I hate to be that like toxic positivity person because it sucks. Like IVF, 7 years of infertility sucks, and I would not wish that on any other person. But I like to try to focus on the good things that have come from it. And I also like to appreciate the bad too. Like I'm very real about my experience, and if it sucks, I will tell you it sucks, and if it's good, I'll tell you it's good.
Yeah, you know what? I always like just hearing you say the toxic positivity
Blech.
thing. Like, I'm like, every time I've actually said about how amazing this community is and how great it is, I then also say on top of that, obviously it's really crap, like going through what
Right.
because you feel like you have to, like, because so many women are like, don't make it positive, and I'm like,
Right.
obviously, but like baby loss isn't positive, and like going
No.
is not positive, but
there are some positive things.
yeah, that have grown, that have become, that we as women have realized through going through these hard things that
Yes.
that we have this strength, that we're amazing, and that our bodies are amazing, and even when our bodies are going through a tough time, they're still like functioning and keeping us alive and keeping us moving.
Right.
So yeah, I totally get what you mean. Like, sometimes people post things like in this space and I'm like, oh, I think I've said that, or oh, I think I'm acting in that way that they don't want, and I'm like, you can't please everyone. Like,
No, you can't. And everybody's doing the best that they can or know how to do. So yeah.
Don't try and please everyone. You're gonna upset people. That's okay.
Yeah.
As long as you're not
and
trying to do it on purpose.
Right. That's my thing, is like, just do the best that you can. Someone is going to get upset somewhere, but as long as you're like unapologetically who you are and doing the best that you can, that's all you can do.
Yeah. Yeah, I actually had someone say to me, I don't know if I can keep following you on Instagram because you're posting about lost stuff. And I was like, okay, that's going through. So I'm not gonna shut up about it because
Right.
my baby died.
Yeah.
Dad.
Yeah. Yeah. And I'm going to talk about my children,
Yeah.
you know? I don't know. I get a lot of that too. It's like, but and I get a lot of like, oh, this post is very triggering. And I'm like, my life is very triggering to a lot of people. Like, this is what I'm walking through every single day, and I'm very sorry that you get triggered by it. Like, I think a couple people messaged me about I shared how many needles that I've used.
Mm.
And like it was a very visual post. And I'm sorry that you're triggered by the amount of needles that I have to use, that I actually have to use on my body to try to keep a baby alive. Like, I'm sorry that you're triggered by that.
Yeah.
Imagine how I feel.
Yeah, I think I saw that post, and every time I see those posts, I'm just amazed. Like, I'm like, wow, you like did that. Like, you went through every single one of those needles. I hate needles. Absolutely hate
Yeah.
them. Like, I'll avoid the doctors just to not get one. And then
Uh-huh.
you know, you see these women like yourself going through IVF, and you're like doing it every day, and like just like, and
3 times a day.
who are you guys? She's just like, and I'm like, wow, like, what is that? How do you do
Yeah.
that? Like, I'm
Yeah.
terrified. I don't want
It's
to
a
do
lot.
that.
Luckily, I have a medical background. I had poke needles or poke people for a living.
That's unfair. That's
Yeah.
for the rest of everybody else, you know?
Yeah. And it's so different when you're poking somebody else versus when you're poking yourself.
Like, oh, this,
I have no problem poking other people.
yeah, this is a bit different. I don't know if I like it.
Yeah.
I think I prefer poking them.
Yes. Much prefer that.
Newfound appreciation for those who get poked, like with needles.
Yes. Yes. I have a little more sensitivity when I'm getting people numb for their dental appointments.
Yes. It's okay. I have gone through many needles. I know how this feels.
Uh-huh.
Maybe not in my mouth, but
Yeah. I have a couple in my mouth.
on my butt, and like,
Yeah, my butt.
and they're just like, what are you doing in your life?
Yeah.
People don't know.
No.
Oh, the best, the best. Yeah, that's something you got to pull out at parties. Yeah,
Yeah.
I've had needles in my butt, like
Yeah.
big ones. I've seen those.
Real big ones. Real big ones. 2 inchers.
Oh, oh no,
Yeah.
I'm good. I'm good. No, I couldn't do what you guys do. You're amazing.
Yeah. Well, hopefully it'll all work out for the best and it'll all be worth it.
Well, I'll be praying for you. Um,
Thank you.
how how have you gotten through all these ridiculous like comments and stuff? Because I mean, you're almost at 30,000 followers. You know, so that, I mean, because I saw, like, I have a mixture of people like with, you know, little to nothing followers, and people with a lot more. Um, like, how do you manage that, like, mentally?
Um, it so when my first reel went viral, it was a pretty sensitive, like I don't want to say private, but it was a pretty sensitive post. It was my husband and I looking at our pregnancy test for our second transfer, and it was negative. Um, and just kind of like said how what all we've gone through, and that again we weren't pregnant, and the negativity on that was crazy to me. And that was kind of my first experience with social media and how great it can be and how awful it can be. So I had so many people reach out to me and tell me, thank you for sharing. I mean, most of the time it's all positive. Like, thank you for sharing. You're so brave for sharing because like I couldn't do it and your profile helps me not feel so alone. And I mean, there's so much good that outweighs all of the negative. But I've had some crazy things. Like this one person made multiple profiles after I blocked them. Like, and one of the profiles was like, "I'm back, Tara." Like very stalker type of stuff. But at most of it is pretty positive. And, I try to put myself in other people's shoes and try to feel like, okay, well, do they just not understand? Have they just not walked through this? Um, so I try to like believe that it's not coming from a bad place. And I think that's what gets me through those really bad comments. Like, but there's been some nasty ones, like um just that I'm selfish for spending this much money when there's so many children that could be adopted. Um, and one thing with the adoption um, part of this, I get a lot of comments like, well, why don't you just adopt? Like that's one of the main threads of
Yeah.
like, why are you spending so much money when there's so many kids that need to be adopted? And not everyone qualifies to adopt. I want to just put that out there. Like, not everybody qualifies to adopt children. And it's not bad to want your own biological children. It's not bad. People spend their money for what they want. And if I want a child, I have the right to spend my hard-earned money to pursue that. Like anything else anybody wants to buy. People that want to buy a really nice car, they worked hard for that money. They can buy a really nice car. Like I just don't understand why that is a common thread through most of the infertility community. It's like you're selfish or awful for wanting, like, paying all this money and putting all this time and all this medication for a genetic child when there's so many that need a home. And it's like, we applied to adopt, so we didn't qualify.
Yeah,
Like
that's something that's gotten me as well. Like I've heard a few ladies sort of say, not everyone qualifies, and I don't. And I had a little look into adoption here, and yeah, we didn't qualify either.
yeah.
A lot of people don't. Like, it's crazy. Like the adoption in I'm going to call it an industry because that's what it is. It's backward. Like, it's not even sorted in a way where people who actually want more children, who actually care and want to look after and raise children, get children. Like, I'm sure there are nice people that get children too, and I have a few on this event who seem lovely and they've adopted and it's great. But she's a doctor, GP, so that's probably part of how she
Right.
did that, because I've heard, a lot of people don't actually qualify, and it is ridiculous that everyone's like, why don't you just adopt? It's like, because it's not just, is it? Paperwork.
Right. Yeah. I mean, it was 80 pages of paperwork just for the initial application.
And you did that, and then it was like, no, sorry. Gosh.
Yeah. And like it's still a possibility for us. There's just you have to be a resident for a year. You cannot be pursuing fertility treatments either. So that's a big one.
Yeah. I've heard that one. But yeah, you're right. It is funny. Like, people, it's funny what people have a problem with when it comes to like spending your money and what you're spending your money on.
Right.
Because you've got people who will like go shopping every day and buy new clothes every day. But then sometimes it's those people who are going to you, well, why don't you just adopt? And it's like, well, and you're wasting your money on this when you could do this.
Yeah.
What are you doing? Like,
yeah.
Exactly. Remove the
I
plank.
don't get my hair done. I don't get my nails done. I don't go to the salon. Like I work hard and
Yeah.
I want to be a mom and this is what I want to do. So
Yeah.
support me.
Yeah, one of the speakers on this event said that she was like, most of the people who talk about me adopting and keep talking, like mentioning it and stuff, she's like, they already have children and they chose to have biological children. So they chose to have biological children and they're telling me to adopt. Would they adopt? Would they do that? And it's true, like when you're told you can't have something, there is a sense of wanting it more, right? Like when you're struggling and you're being told no, you're like, well, no, I want that. What are you talking about? Let's, we'll make it happen. So yeah, and yeah, people who have children shouldn't really be saying
Right.
just adopt.
Yeah.
Sometimes
Have you
they're
thought
saying it as an
about
option.
this or that?
Yeah, sometimes they're saying it as like, oh, it's an option for you.
Right. It's like I fully looked into every option before we stepped into IVF. I just chose IVF just out of the blue one day,
Yeah, like
because it looks like fun.
I think the Renee, the speaker I was talking about, she sort of went into how like Hollywood and all that, like make it like, oh, just do IVF.
Yeah.
And I think that's the problem because, then people have that false idea
Right.
it is. And obviously until you're in the space, you don't see it. Like you don't know.
Right.
But
and like Hollywood makes IVF look so bad in so many ways. Like with the whole Paris Hilton thing, wanting to like just keep banking embryos until we get a girl embryo. It's like that just puts such a bad light on IVF in general that it takes away from the people that actually need it to start their family because of a disease.
Yeah.
And so like it wasn't like this like, oh, we chose this just because we wanted to do it. Like I have a tumor in my brain, I have PCOS, I have endometriosis, I lose babies when I get pregnant naturally. Like it's a diagnosis and it's treatment for a diagnosis so that I can have a child.
Yeah.
And that's what it should be.
Yeah, I have a few speakers who have gone the surrogate route because their body just, couldn't, like they didn't feel like their body could cope with it, with the pregnancy.
Right.
It just wasn't happening. But yeah, it's amazing what people say to you, like, and like even down to them getting a surrogate, they felt weird about it. And I think a couple of them actually said they had comments as well. So, about like, oh, well, only rich people get that. And like,
Yeah.
why don't you just adopt? And like, there's other ways
Well,
to do
adoption and surrogacy are they cost about the same unless you go through like the state. Private adoption is expensive. Surrogacy is expensive. IVF is expensive.
It's all expensive. And you know what? Even with adoption, you're not guaranteed. Like I had a lady who was going to adopt a baby, and on the day she went to pick the baby up, she came home with an empty car seat because the mum had changed her mind.
Yeah. And in some states, the mom has 48 hours. In Washington, they have 48 hours to change their mind. In Texas, they don't. If you sign the paperwork, that's it. But in some states, like they have time to change their mind.
Yeah. Yeah. And I mean, some people will say, oh, we'll just like adopt a like fully grown child. But at the same time, like if you're, a new parent, going from baby stage is the best way to do it because you have to learn you're growing with child at the same time.
Right.
And is like sometimes, the the way for a lot of parents, you know. But
Yeah.
adopting a fully grown child could also be your journey and could be a good way of doing it. But yeah, I think like most of
Well, and
us
people,
who want a baby, you know.
right. And people don't think about all the trauma that an older child has gone through in their life. If they've been in the foster care system, like that's traumatic. Losing a relationship with your biological parent is traumatic to a child. And most of these older children have been passed around from house to house. They've seen abuse, they've seen drug use, they've seen, I mean, it's not just like, oh, you get a 5-year-old that, I mean, you have to know how to deal with trauma.
Yeah, my husband was actually talking to me about it today, and he was like, I actually think people who adopt are just like beyond amazing, just amazing people because of all the extra layers that
Yeah.
goes into raising a child that was not born from you. Like,
Right.
you know, it's you know, you've got all these issues that you're going to have to deal with, and even if you don't have extra traumas like the drug abuse and things like that, you still have the issue of the abandonment type thing.
Right.
Because although
Yes.
maybe their parent did want them, or maybe their parent died or something like that, it's still a form of abandonment. So then
Right.
you'll have to deal with that regardless.
Yeah. Yeah.
But yeah, no, it's amazing. And people just don't think about it. They don't think about the many
No.
layers, you know, and
Just throw it out willy-nilly. Why don't you just do that? And it's like, well, think about it.
did you think about it before you posted?
Yeah.
Don't comment on
Yeah.
the post. Just move on.
Move on.
Yeah, no, it's funny. Like some of the comments that I've had on a few of my posts, I've just kind of been like, I don't think I should answer any of this. I think I should
Yeah.
it. And I said that to my husband. I was like, what do I do? Like, he's like, well, don't take it personally and just leave it. And I was like, okay,
Yeah.
I will do that.
Yeah.
That makes more sense. Because a lot of the
Mm-hmm.
time, these people that comment on our posts, that they've got their own crap that they're dealing with, and that's
Right.
they're doing that. So
Right.
leave them with their crap. Leave them with their
Yeah.
crap. If you have to block them, but leave them with their crap to deal with, because you don't need to
Yeah.
do that. You've already got to deal with what you're dealing with. Like,
Right.
they can have their own thing.
Yep.
Yeah, I like that. So how have you gone emotionally with the losses? Because I know you're still on this journey, you're still going through fertility treatments, and obviously going through treatments at the same time as dealing with loss is really difficult because you're still in it. You're still in that that headspace and in that body
Yeah.
going through those things. So is there anything that you've been sort of doing to kind of help you stay on a sort of even kilter, or get through and be okay?
Um, I mean, I'm a very religious person, so that's helped a lot to get me through um diving into scripture and like just acceptance as to like that I'm not gonna have that child. I'm not ever gonna meet that child on in this world. Um, but that I'll have 5 babies waiting for me when we get to heaven. That has helped me a lot. Also, coping with the blame part is a big thing for me because I blamed myself. Like um, it was my fault. Like I had a cup of coffee, or I had like I moved too much, or I didn't eat what I was supposed to eat, or like I did a lot of that. And so working through those emotions and learning how to carry the loss, I think is a big part for me because it never goes away. Like it never leaves you. Like I was pregnant with these children and it never goes away. You just learn how to carry it. And I think that is a big part of my journey too, just trying to cope with trauma and loss has been a big part of my journey because it's hard.
Yeah. Yeah, and I think a lot of women sort of have a similar thing of, trying to just sort of deal with that, like cope with, okay, I've gone through that and this is now part of me. This is now part of my experience. But getting to that thought process is quite hard because like you don't want to accept who you are. You don't want to accept those changes,
Right.
Has it been a long journey for you to accept the differences? Because obviously you would have been very different from like the person you were before this whole journey.
Yeah.
So how like what have those changes been like and how have you accepted them?
It's taken me 7 years to learn how to accept it. Um, the last 4 months that we took off between our last transfer and now have been life changing. And I actually set it down, I think, and prioritized me and my health. Um, and I really focused on, like I said, scripture for this last 4 months, and it's been life changing. Like I've learned how to not hang on to it and just give it to God. And I didn't know how to do that because I'm such a type A person. I need to control everything. Um, and this whole journey is so out of your control. You have no control over it. You can do the best that you know how. You can eat the right things. You can not exercise the wrong way. I mean, there's so much pressure on you, like to do the right things and to do all the things and to eat the Brazil nuts and to drink the pomegranate and to do the tea. And it's so much pressure that I've learned like over this last 4 months, just because what other people say is the right thing to do doesn't mean it's the right thing to do for you. And letting that pressure go has been a big part of my transformation the last couple months. And I just feel like such in a better place mentally and physically and spiritually that I can take another step forward because I just felt so crippled by all of it. I just wanted to sit down and like not get up. Like I'm done. But I think just like learning that it's okay not to be perfect because it's out of your control anyways, it was a big part for me.
Yeah. Yeah, no, that's really awesome. And I'm Christian as well. So I know what it's like when you pick that Bible up and then you start reading. Like there is something so comforting to just sit there and read scripture.
Yeah.
Yeah. I'm a King James girl. I read King James. I just love how poetic it sounds. So yeah, all the other versions I just don't feel the same thing. So
Yeah.
I get my King James Bible, I read it, I'm like,
Yeah. Yeah. It's a weight lifted off because you're able to give it to him.
yeah. And sometimes I'm like, I don't know what to pray, I don't know what to do, I don't know like what to say. So then it's like, oh, I'll read some scripture because
Yeah.
you know, there's nothing else I know to do. And
Yeah.
it makes you feel better. It just calms you. And even when you're reading some of the more intense parts, like in the Old Testament, and you're like, oh gosh, wow,
Uh-huh.
they did some crazy stuff. Just
Yeah. I like the after Jesus stuff the best.
sometimes like I've been reading the Old Testament and I'm like, this is like soap opera this is like Game of Thrones. Like I didn't
Uh-huh.
watch Game of Thrones because I wasn't a big fan of certain things that were going on in there, so I just stopped watching.
Right.
But then I'm reading the Old Testament, I'm like, wow, like some of this stuff is like juicy
Uh-huh.
stuff. Like, what? How many
Yeah.
wives? Why would you want that?
Uh-huh.
Like,
Yeah.
oh, and then one woman, she was like, oh, she couldn't have his baby. So then she handed him her handmaid. And
Yeah.
I was like, but
Yeah. Wait. What? Wait.
that's what we need. We all need handmaids.
We all need a handmaid.
But yeah, no, I thought that was kind of like really interesting. And then they ended up having babies as well. So then, yeah, but I was just like, really? What?
Uh-huh.
What is going
Well,
on?
and it's funny when you start diving in how like relatable all that stuff is too. Like it's real life.
Yeah. And like Sarah, who couldn't have babies, and
Mm-hmm.
she had babies at like 90.
Yeah.
But yeah, like so relatable. And there's moments in there of loss and heartache and pain. And yeah, there's just, I think it's really healing. So yeah, if you can share
Yeah.
some of the scripture passages that have really helped you, that would be amazing, because then I can
Okay.
share them below with whoever is interested. Um,
Yeah.
but yeah, we have quite a few women who are in the faith who have been talking on this event. I didn't mean for there to be so many, like it just sort of
Uh-huh.
happened. Maybe it's God like connecting us, I don't know.
Yeah.
But yeah, it's been really amazing. And actually, before I came on to tonight and started doing interviews, there was a massive rainbow in the sky. Like
Oh.
massive. It was like all the way across, like just this massive arch. I couldn't even take a picture on my phone because it's so big.
It's so big. Oh.
And I was just like, wow. And my husband was like, I feel like this means God's with us. Like, I feel like
Yeah.
speaking to us right now. And I was
Gets
like,
me all emotional.
I hope so.
Yeah.
And he's like, are you thinking of baby? And I'm like, yeah.
Yeah. Yes.
Let that be the baby.
Yeah.
Oh, the emotions, it just gets you. But I will be praying for your baby and praying for
Thank you.
your embryos to make nest in your womb.
Yes. Thank you. I'm
Um,
so glad we got to connect today.
yeah, it's been really lovely. Is there anything that you wanted to maybe say to anyone who's in the throes of it right now, who's in the journey with you? Because I know you're going through it right now as well. So is there anything that you would want to say to anyone? Yeah.
It's okay to rest. It's okay to take time off, even though you feel like your clock is constantly ticking. Um, just keep putting one foot in front of the other and do what feels best for you. Um, because each of our journeys is so different. And what is right for one person might not be right for another. And to just keep moving forward at your pace.
Yeah. Yeah. That's beautiful. And you know, something I've been learning here in this space is you know how much you can go through. You know how much you can do. And when you're ready to close that door, you'll know when that
Yeah.
like even when we're like, oh no, I'm not going to do it again. Like deep down, you know
Uh-huh.
we're going to do it again.
Yeah.
We go for
Yeah.
it, we say it and we're like, oh, I didn't truly believe that though.
Yeah.
But when you know, you'll know. Don't stress about that door. Just go with how you feel in the moment and yeah, listen to yourself. That's so
Yeah.
important. Thank you for sharing that. Thank you for
Yeah.
sharing the story and speaking with
Well,
me.
thanks for having me. This is fun.
Please note that all speakers, including experts and professionals, express information, views, and opinions that should not be used to diagnose, treat, cure, or prevent any medical conditions. If you have a medical issue, please consult a qualified professional. Speakers voice their own views, opinions, and conclusions, and they may not reflect the views, opinions, and conclusions of other speakers. Ella Rose, The Joy of Sunflowers, and its sponsors may not endorse all or any of the views, opinions, or conclusions expressed.